She was pregnant, and before then she was trying to conceive. It was kind of difficult for her. I'm saying this so that those of you that are joking with global leaf water should have it in mind. Hello, welcome to my channel. Welcome to Journey with Judy. Today on Journey with Judy, we still have our faceless guest. If you don't know who our faceless guest is, she was in my last video, and she's yet to tell us about her experience with fibroid and pregnancy. Hello, welcome to our channel. Thank you for staying. Thank you for coming back to our channel.
Thank you very much, Judy. Thanks for having me. It's a pleasure to be here again to share my story.
Thanks. So the last time we talked about your experience with fibroid. You told us how you discovered you had fibroid, your experience before you got married. Now you're married, you have a baby. Please, can you tell us your experience with the fibroid and pregnancy?
Okay, thank you very much, Judy. So, I got married like a few years ago, and so, like I said in the previous video, I love children, and so that was like one of my major prayer points, besides having a beautiful family, of course. So after marriage, I was just
You got to have
yes,
babies, children.
like I wanted twins. I didn't mind starting up with twins or triplets, but at the end of the day, anyone is just fine. Children are just gift from God, and anyone is fine. So I was very keen on getting pregnant. Like usual, I talked to Judy, and before I talked to Judy, or actually, the first month passed, the second month, I'm like, I'm not pregnant now. What was this? Also, I'll be like, chill. Like, we're just few months
Just
into
few
this
months.
whole marriage thing, and you're just getting crazy. Any months my period come, I'll be like, hey, my period came on. That means I'm not pregnant. So, and then I contacted Judy, and she said, baby girl, there's this thing that's very effective, guava leaves, and you just take it. I think she did few days to my ovulation. I can't remember how she said I should take it. See, I forgot it, but I know she said I should take it. Is it after my menses or after my ovulation? Please remind me.
That's during your menstruation.
Okay, during my menstruation. So just before ovulation, so that's right. It's even logical. So I did, and guess what? That month, though, after I took that thing, the next month, I did not see my periods. Like, I'm like, okay, I've never been pregnant, so I don't really know these things, but I have these test strips, and I tried, and I saw the mark. I'm like, I don't know. Besides my husband, she was the first person I reached out to, and I showed her the picture. I said, babe, we'll see. I just took a test, and this is what I saw. Like, you're pregnant. I said, you sure? Are you sure? Are you sure? Say there's nothing you can tell me about it. I know that I heard from people say that sometimes you can test my show, but you're not really pregnant. Say you're pregnant. It's showing very clearly. I'm like, thank God, though. So I was very, very happy, and I was just happy, thanking God and everything. So that was that. After that, no, before I even did that test, I discovered I was having this pain. It wasn't so bad, but I was having this pain. Yeah, it was around my right pelvic region. So I was having this pain. It wasn't so bad, but I didn't really take it seriously until I discovered that I was pregnant. And so after that, I went to the hospital, and I complained that see what I'm having, see the pain I'm experiencing, and I think I'm pregnant because I just did a test and came out positive. But then they had to reconfirm, so they did me another test, and although that was just urine test, so they confirmed that it was positive. That point my mind came down. I don't even believe my own. That point my mind came down, but then they were going to send me for an ultrasound to know why I was experiencing that pain. So I went for the ultrasound, and although the sonographer told me that from the scan, they can't really see that I'm pregnant. Though. And that's quite expected, because later I got to know that at that early stage, because I think it was
Yes.
just few weeks,
It will show.
it too showed. The scan cannot really detect the baby. So I said, okay, no, it's fine. I took the results to a doctor, and when the doctor saw the result, all he was interested in is the myoma. That all I can see here is multiple fibroids. Before then, the nurse that I met was even very nice. She was encouraging me that, you're very lucky with these multiple fibroids. I don't think I mentioned it in my other video. The fibroids are actually multiple. So I had multiple of different sizes, like they were everywhere, covered in my uterus. So the nurse was like, I was really lucky to have taken in with this number of sizes and everything. But then the doctor did not even help matters. So I was like, with this number of fibroids I'm seeing, how am I sure
Imagine,
that
can't
I'm
be
even
pregnant. Is
pregnant?
it God?
Don't mind him. He was even saying, how am I sure it's not even an ectopic pregnancy? He said, I remove fibroid though. Come, let's remove it. Is that what you tell somebody? I'm like, that's the least thing I wanted to hear then. So he said I should go and do a run scan, and I should go and do this time around a blood pregnancy test. I was like, okay, no problem. But he said I should go and do it in one private clinic like that. No, a private lab. I said, no, doctor, I want to do it in this hospital. He said, no, don't waste your time. I'm like, is it your
Who
time?
knows if the lab is his?
Maybe it's his or his friends, because that's what they do now.
Yes.
But I insisted. One, I didn't go for that scan because I felt it wasn't necessary. I just did a scan less than a week and I sent it for that scan when you know that it's not going to even detect. But so what I did now was the blood pregnancy test, but I had not done that. So when I did the blood pregnancy test, immediately I collected the result and I saw positive. My mind just came down. I just abandoned that doctor.
Are you serious?
I went and that was soon. Yeah, because leaving his office, I was just tense and everything. That's not how you talk to a patient, you know. So I left and I went to another hospital. I'm lucky, found good for me this time around. It was a very good hospital. The doctors were very nice, the nurses, in fact, they were very encouraging. They were encouraging me that it's possible. You can actually have the baby and the fibroids, but it's not going to be easy. But then it's not impossible. So at least that gave me hope to actually continue. So aside from that, I was fine. The pain wasn't so bad, so I could cope and everything. But then in week 8, I noticed that I had spots and
In week 8.
either week 6 to 8. I can't remember exactly.
Okay, please,
but
I want to
week
cut
6,
you
8,
short.
okay.
So, from what she said from the beginning, she was pregnant. I want to just give us a little summary of
Okay.
what you just said. She was pregnant, and before then, she was trying to conceive. It was kind of difficult for her. I'm saying this so that those of you that are joking with guava leaf water should have it in mind. After she tried for some months, it wasn't she tried and she wasn't pregnant. Then she called me and told me, and I told her about the guava leaf water. Okay, there are many remedies you can use that can help you to boost ovulation, that can help you to conceive fast. So she took the guava leaf water, and that month she became pregnant. And of course, guava leaf water is very strong. So if you are taking it, I made a video on that, so you can watch the video. Don't just go cut guava leaf and take the water. Please watch the video. I'll be dropping the link in the description box so that you go watch it and know how to boost your ovulation and become pregnant. So let's go back to our faceless guest. And yes,
That means when next I want to get pregnant, I'll take a lot so I can give birth to triplets.
sure, there are other things you can take if you want to increase the egg, if you want to your ovulation and everything. There are other things you can take to make it so rich. So let's go back to our faceless guest. So you're saying something about sporting.
Yes, I think I can't state categorically, but I think that was week 6 or week 8. I was experiencing this spotting lumps of blood. So I got really scared because I know that once you see blood, the first thing that comes to mind
Sure.
is a miscarriage. I went to the hospital and the doctor said, okay, we're going to send you for an ultrasound. And in the ultrasound, what he wrote was missed, like, I've forgotten how he wrote it, but something missed miscarriage. Like, that's the diagnosis. I'm like, it's not for me. Oh. So I went, although I was tense.
That was before the scan.
Yeah.
Was it before the scan?
No, this was another scan. After the spot, he sent me for a scan. Like, no, that's what he wrote. Like,
What he wrote.
just what they are checking for.
Miscarriage,
What they
okay.
are checking for.
Okay,
It's not
okay,
like
okay.
it's confirmed.
Okay.
So when I went and they did the ultrasound, so when the sonographer just said the baby is okay, that was all I needed to hear.
And he took
But
a
he
deep
didn't
breath.
stop. Yeah, he took a deep breath. I'm like, yeah. Although before the mother had already assured me that there's nothing wrong with the baby, calm down, don't be scared. I'm like, okay. That one, he was just talking. So, but the sonographer did not stop there. Oh. He said, madam, from what I'm seeing, this pregnancy, you'll be the one praying that the pregnancy should just come and
Just imagine.
end. That it's not going to be easy. Oh. That because of the multiple fibroids, it's going to be really painful and challenging. That in fact, the baby may not even make it. I just looked at him and said, I believe in God.
That was so harsh of him.
Yeah. Maybe, perhaps he thought he was trying to, I don't know. I just looked him in the face and I said, I believe in God. And then I went home and just started like, okay, like normally, like every pregnant woman now, we like feeling like eggs. So yeah, I was just trying to be as careful as I could, and taking all the necessary precautions. Of course, I was taking my routine drugs. I was giving only fesolate and folic acid, which I took very
Okay, we're not giving
seriously.
vitamin C.
Yeah, sorry. I was giving vitamin C actually. I was, although to be sincere, I didn't really take my vitamin C so much. But please, you take yours. Or I
But I
took.
took your folic acid.
Yes, yeah. I didn't joke with that and my festolates because I read that they are very important, even the vitamin C for a healthy development of the baby. So, but mostly throughout the pregnancy, I was very anxious. Like my pregnancy journey was full of anxiety because I've heard a lot about fibroids and miscarriage, and so I was just very anxious. But then I kept praying and I believed in God, and so I prayed, and I just knew that nothing was going to happen to my baby. And my husband too was very helpful, was there to encourage me and to help out in every way that he could. So the rest like are normal pregnancy stories now. Like if you've been pregnant before, you know the pregnancy wahala, the cravings and looking for things that do not even exist. Then mine was so bad that if I'm just passing through any place and I see a billboard, maybe a billboard of an eatery, I'll just start craving for that thing that is drawn on the
Are you
eatery. Like
serious?
remember one day I even cried because of fish roll. Like I wanted fish and it was not available and I cried. In fact, my husband had no option. So well, that's by the way. But then besides that, pregnancy was progressing well. But towards the beginning of okay, so I took it in, let's say, July. Then sometime in towards the end of September, I started noticing this very bad pain still on my right, but this time around it was so bad. I tried to manage, but I couldn't. I tried to manage, but I couldn't. So I had to go to the hospital. And immediately I even went because of the pain. They said, no, this one we have to take you to the emergency.
Wow.
And immediately I was admitted. And first I was administered paracetamol injection. Wow, that injection is so painful. I never knew. In fact, after then, any nurse that comes to me and say, I want to give you pain, I'll say, is it paracetamol? Don't give me. So they said, okay, we'll send you for an ultrasound and everything. But before then, they just placed me on some painkillers, pain relief. Like I think it was basically Penta. They call it pentadosine, but I know the short form is Penta. And then I think the diclofenac. Although I have ulcer, so they said I can't take the ordinary diclofenac. They were giving me the rectal diclofenac. Then when I went for ultrasound, they said the pain was as a result of red degeneration.
Okay.
So this time around, they call it red degeneration. That
Red.
red,
RED.
yes, RED, like color red.
Okay.
That the fibroid, because of the baby that's growing, coexisting with the fibroid,
Fibroid.
like they're kind of struggling for nutrients, so the blood supply. So the fibroid was not getting as much blood and everything that it was getting before because now it has a competitor. So it was kind of degenerating that, trying to shrink because it was not getting that supply. So it can be really painful. I remember there was another woman that was also admitted that was going through that. So in fact,
She also has fibroid.
she also has fibroid. So
And was she pregnant?
she was pregnant. So that was what was so happy. So if when I thought mine was abnormal, at some point I thought it was not abnormal because I'd seen someone else. Although I went online, but the thing is,
Some persons don't experience it.
some people don't experience it because I was
No,
searching.
body differs.
Yes, I was searching for videos, and some persons yes experienced it, but some persons just their pregnancy was very uneventful, and then so but I was also googling and everything. Please, one advice I want to give you, it's good to make your research, but there should be a limit to everything because you just give yourself BP. So that period I was always reading, always googling,
Ah.
always this, always that. But it's good, but just know the limit because you don't need stress too. Those things can actually stress you. Just believe in God. And so then I was admitted. I stayed in the hospital for like 3 days or going to 4 days. On the fourth day, I told them please to discharge me because it's not like I wasn't getting really better because it was just the painkillers. We're using it to mask the
Sure.
pain. So me, I was tired of all those injections and everything. I'm like, okay, see, please discharge me. Let me go home. I prefer to like stay at home because I don't like hospitals, and so I feel that psychologically I'll be
You
better
definitely
off.
recover
Yes,
faster too.
faster. But one thing again, I noticed that they were giving me lots of drips like fluid, because they said that fluid is very necessary. That what happens is that during that degeneration, like some chemicals are released, and that's what causes the pain. So,
Pain,
but I should take, even when they discharge me, they told me that when I go home, I should take
water.
lots of fluid, so that it just flushes it out. So that period I was taking fluid, but the good,
So when the fibroid is shrinking, a chemical is released.
according to the doctors,
Okay,
yes.
and
So
what you need to help to reduce the pain is fluid.
fluid, yeah, fluid and rest. These are
Fluid
the
and
two things they
rest.
told me. Fluid and, it's not like it's going to like take care of the pain entirely, but it's going to help. It's going to help. So that period, because of pregnancy, I couldn't take ordinary water. But I asked the doctor if I could take cold water. I said it's fine. Water, as long as you're taking in some, it's better to take cold water than not take cold water. That's what the advice from my doctor. Because some people will tell you that if you take cold water, the baby will not want to come out. And the baby will just sit in the womb and be so comfortable.
Mm,
But the doctor said I could take, since that was what so I was taking lots of water, and so I was just managing. So I got discharged, I got home, and but because they told me to avoid certain things, even on my own, I couldn't do certain things anymore because of the
the
pain.
pain.
I noticed that if I
And
do,
the baby is growing.
yeah, so if I should walk too much, it increases the pain. So I was mostly on bed rest and taking lots of fluid, and it wasn't easy, I must say. It wasn't easy, but then knowing fully well that my baby was progressing well was just something that kept me going. And each day I would pray for the baby, and I look forward to meeting the baby. So after then, this was in September into November into October. Then sometime again towards the end of October,
What trimester is that?
this was in second trimester. I experienced that same pain. In my first trimester, I didn't have any severe pain. But this started in my second trimester, I guess maybe because then the
The
baby is
baby,
already
yeah.
growing. So I remember I spent the 1st of November in the hospital. So yes, that was my second admission. Nothing changed, the same painkillers, the same everything. In fact, I became like their customer. So they knew me, and when I come, they already know my history and
The drug to give you.
the drug to give me. So me personally, I even know the drugs to take, just that I still need them, their medical
Sure.
care. And so after 3 days also again, I got discharged, and then I just came home and just continued the self care, the resting. So my husband was basically doing everything. It wasn't easy for him though, but he was there, and that care and encouragement was just very necessary. So the pain did not stop. I wouldn't say the pain stopped, but it's like this. There are some days I'll be perfectly fine. There are some days I'll be in pain. So I kept on. My hospital visit was more regular than every other normal
Mhm.
pregnant woman. So if you're pregnant with fibroid, don't feel sad that you have to go to the hospital more often. That's not what is important. What is important is that your baby is
Sure.
healthy. So please look for a very good gynae, because it's when you have a good gynae, they'll really help and guide you and keep monitoring you to see that the baby comes to term. So then I remember Christmas. On Christmas Day I was in so much pain, but that didn't stop me from eating my Christmas. I ate the Christmas chicken and fried rice and everything. So
So the pain did not stop anything.
no, the pain did not. The crave, my craving, the pain was there, but my craving too was bad. Because I remember one day I was on the hospital bed eating my chicken like this.
Mm.
And my doctor came, he was just like looking at this woman. I said, "Doc," he said, "the pain does not stop you from eating." I said, "Doctor, it's not my mouth that is paining me." So I
It's your
could eat.
stomach, it's not your
Ah,
mouth.
so I enjoyed throughout Christmas, but sometime in January, I think there 20th, or I know it was 20 something though, the pain became very bad, and I had to go to the hospital. This was like around I think I was getting to 30 weeks then. I went to 30 weeks then. No, I was still no, I was not yet in 30 weeks, but thereabout. I was admitted again, or this time around,
That's the third
the
time.
third time. So this time around, they had to move me. Other times when I come, I get discharged from the emergency ward. But this time around, they told me they will move me because after 3 days, 4 days, I wasn't getting better. They told me they will move me to the main antenatal ward. I didn't feel so good at all because I'm like, I'm not yet due. So why
Yes.
am I going to the
It's an
antenatal
accidental word.
ward? And then I was transferred there, and then I will see other women, they will come, give birth, go.
And you
I
just
was just
remain
like
there.
permanent patient. Like, so wasn't easy, but then we're trying to manage me. And at that point, I think at some point after 30 weeks, I couldn't take rectal diclofenac anymore.
After 30 weeks
Yes, because they said that after 30 weeks it's no longer safe
for your baby.
for a baby. So I was basically on penta and other things, and fluid, of course. So, and they just like, okay, see, we know that this baby, you may not be able to get to 40 weeks because of the pain, but at least try and get to 34 weeks, because they believe that at 34 weeks the baby will be fully matured. Not like fully matured, it's still preterm,
Yes.
but then it will be moderately preterm.
The lungs.
Yeah, the lungs will be developed and it will be moderately preterm, so that the baby will not even have to go through the incubator and everything. So, but then God had his own plan. So, oh, I'm not talking too
No,
much.
no, that's fine. You're really
That-
learning from your
that
experience.
I don't bore everybody. So yes, I'm trying to, because right now the whole thing is past, so I can't remember specifically. But on a certain day, that was just few days. So let me just jump. So on a certain day, I told them, okay, see, I'm tired of staying in the hospital. I want to go home. But then there was this new pain I was experiencing. At that point, I was not on any injection because they had given me
Different from the usual pain.
different from the usual pain. At that point, I was not on any injection because as though they've exhausted all their painkillers, so they just giving me this other one, and I was not on any fluid because they said I had taken too much fluid. This other drug the doctor prescribed for me, it was a tablet. Although he said I needed to stop that tablet like weeks before I deliver, because if I take it, like, the baby, it could affect the baby, so that the baby could have withdrawal syndrome. This was just what he said. So at that point, I was already on tablets, and sometimes nurses will even forget to come and give me my drug. Like, we're getting tired, kind of. So I told my daughter I wanted to go home, even though on that doctor objected. My doctor said if I want to go home, it's fine. Although he came and asked me if I was having contraction, I said, doctor, I don't know. I've never been pregnant, because there was this new pain I was having, but I didn't know. I said I've never been pregnant, and he said, okay, you can go home. So I was discharged. The following day, the new pain I was feeling got so bad, like it would just come and go. For me, I could not really tell if it was still the fibroid that was causing the pain. So I said that, okay, let's go for an ultrasound. This time around, I went to a private lab. They're actually very good. And immediately I started the ultrasound, the sonographer said, "Ah, are you having contractions?" I said, "Ah, I wouldn't know. I've never been pregnant, but this pain is kind of new and it comes and goes." And he said, "Ah, madam, you're having contractions. Oh, please, from this place now, go to the hospital because you're entering labor." I'm like, hey, me that just told them to discharge me. So I went back to that same hospital. They said, but we just discharged you yesterday. I said, well, this pain now is getting so bad. And well, to cut the long story short, I was readmitted and they said, okay, you're having preterm contractions. And well, that's to be expected because most people that have fibroids actually experience preterm contractions. So, but they were like, I was still at 32 weeks, going into 33 weeks. But they said we have to manage you. That we just wanted to get to 34 weeks. I forgot to mention that before then, I think at 32 weeks, I was given a drug for the baby. Like, I was injected, but that injection was to help the baby's lung develop,
Okay.
just in case the baby comes out at any time from then. So let it be that the baby's lung is already getting developed. So then, so that day the contraction became so bad, and I was just screaming in the, not like I was screaming, but like you could notice, my neighbors could notice, and people were just coming to like encourage me and everything. And so that night my doctor came and said, oh no, we have to, oh no, before then the nurse came to check the fetal heart rate, and she said she couldn't feel the baby. Hey, at that point I got so worried. She called the doctor, another doctor came and checked, they couldn't see. So I was sent for an emergency scan. And then they said the baby was okay, so that was fine. My doctor came and said, okay, now we can't take any chance again. We're going to send you for an emergency CS so that we'll just get the baby out. And
That was 32 weeks.
that was 32 weeks, going into 33 weeks.
Okay.
So they said we needed 4 pints of blood because of the fibroid. It was not going to be. They wouldn't do any surgery.
They needed 4.
4 pints because they said I may lose a lot of blood because of the fibroids. And so, okay, so the next month started running around. We had gotten through it. We were looking for the fourth one. So then, as at that time, I just entered 33 weeks. So this was the next day. So I still had that contraction. I still had that contraction for almost 24 hours. More actually, because started the day I was discharged, but I didn't even know it was contraction. And then another doctor miraculously came and said, because already my doctor had told me that I can't deliver except that if it's not a CS, because the fibroid
Position.
mass was actually blocking where the baby would pass through. But another doctor came and checked and said, no, you can actually have your baby
Wow.
naturally, that you don't need a CS, and that in fact he said I was already at 8 centimeter, like dilating. So I was already
Mhm.
at 8 centimeter and he should take me to the labor ward. And at that point he broke my membrane and the rest is history, you know. The whole pain and everything. But then I saw my baby, and in fact, that was the sweetest pain ever.
Wow.
So when I saw my baby, I was just happy, and so that was it. And then definitely my baby was preterm, so my baby was taken to the ICU where my baby continued the necessary treatment. But my baby wasn't put in the incubator,
Okay.
luckily. So my baby was just very small and needed that intensive care. But my baby wasn't put in the incubator. My baby was not even up to 2 kg. But they
Wow.
said the baby was strong
Strong.
and didn't need to be put in an incubator. Then personally, I got discharged the day after delivery, but I had to stay back because my baby was still in the ICU. So the pain reduced, but not like the pain stopped instantly. But at least gradually I stopped feeling the pain. Or the only thing I noticed that I think, yeah, I stopped feeling the pain, but it was a gradual process. So right now I don't even feel any pain anymore. So it was a high risk pregnancy, but then God came through for me and I had a beautiful baby. Thank
Wow.
you.
So that was very painful, but thank God you're fine, your baby is fine. So from you all what you just said about your experience with pregnancy and fibroid, what is your advice to those that have fibroid?
Okay. Well, from my experience, I just want to tell you that why, because I've heard that some women don't go through this pain. But if you have fibroid and eventually get pregnant, just be open to anything. But just know that you can still have your baby very healthy, but then you have to take the necessary precautions. One, look for a good hospital and try to make sure your gynae is a good gynae, because they are going to be of great help managing you and the rest. And then try to take all the advice that your gynae will give to you, especially that of rest. I know of someone else that they have to place on total bed, complete bed rest. Yes, because there is this tendency that
Imagine staying in the hospital for months.
no, 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 like even in your house, wasn't in the hospital, like just at home. But
Okay.
then you wouldn't say because you're not in the hospital, doctor is not seeing you, and then you would not. So try to take that bed, and then fluid, like I said, even naturally for every pregnant woman, fluid is necessary.
Very,
But
very.
you then that now have fibroids, you just know that you have to take lots of fluid and just trust God. There's nothing God cannot do, and you can still have your healthy baby even with fibroids. So that's what I have to say. Thank you very much.
Yeah, thanks a lot. Thank you for sharing your experience with us. So we've heard what she said, her experience wasn't funny, but if you are pregnant with fibroid, it doesn't mean that you must go through that pain. Body differs. I've seen people that were pregnant with fibroid and they just had a normal pregnancy experience. There wasn't any pain and they had a baby. While for some persons, it's not just easy, it's not funny. So from her advice, try to rest, try to take lots of water. So if you know you have fibroid and you're pregnant, taking lots of water, fluid will help you. Okay? And also rest. Our body need that rest. Your baby need that rest. So thank you so much for coming on this channel. That is it for today's video. Please, if this was helpful, give us a thumbs up, subscribe to our channel if you're yet to do so. Share this video with your friends and loved ones so that they can also benefit from her experience. Thanks for watching. I would love to see you in the next video. Bye.